One of the biggest challenges that pediatricians face is getting user-friendly treatment for babies living with HIV. This has led to many children failing to take the correct dose of medication, which could lead to the emergence of drug-resistant strains of the virus. However, a new strawberry-flavored tablet developed for children living with HIV is giving hope for health caregivers. CGTN's Enock Sikolia spoke with a pediatrician at Kenyatta National Hospital, Kenya's leading public health facility, and here is his experience.
When a child is born and is identified as HIV positive early on, like say when they are months, because usually we have tests done between 2 weeks to 6 weeks to identify those who are newly infected. So you can imagine a child can swallow a tablet. So initially what we had was a syrup that they would use or tablets that can dissolve in water. The syrup that we had for lopinavir, ritonavir, or Kaletra, as we like to call it, it's very bitter. So the children would not swallow it. So later on we developed something called pellets. Pellets were developed to overcome that problem. But the problem with pellets, you could only take them when the child had been weaned, because you'd mix them with breast milk or porridge or yogurt. And these were capsules that had other capsules inside them, so that as a child was given food, the child would also take the medication. The problem is you'd have to use very many of those pellets. And it would be very difficult for a mother who also has to go and work. So it'd take a lot of time in the morning and the evening, because they have to be taken twice a day. And if you look at the sizes of the tablets, I mean, they're really big. So this is one that a 4-year-old is supposed to take, and it's really big, as you can see. The aim of taking all these ARVs is to suppress the HIV virus to lower than detectable levels. But the way the virus works is you have to take all the drugs. So you can't take the one that dissolves in water and expect it to work on the virus alone. So usually we have a combination of 3 drugs to work on the virus to suppress it. So what we'd find is the one that was the least tastiest would not be taken well. And when you do that, what happens is the virus learns the other drugs. So the ones that you're taking, the virus will learn, because remember it takes 3 drugs to suppress the virus. So you develop resistance to the one that the child is taking. So the good thing about these tablets and the newer pediatric friendly ARVs, like dolutegravir that has just come, is that one, it's scored. So you can give a child 1.5 tablets. So the line makes it easy to just split it at the middle. And then you're able to give the child that medication. And it also dissolves in a little amount of water. It has a strawberry taste that's very pleasant. This one also has a similar strawberry taste that's also pleasant to children.
Have you seen any impact since the child-friendly drugs were introduced?
Okay, so one of the child-friendly drugs is here. And so most children found this easier to swallow. And what we found in our clinic is that once we started moving children to these pediatric-friendly ARVs, is we found higher viral suppressions. So the percentages now moved beyond the 90s. So before we used to be at 88 of our patients virally suppressed, moved to 90. Now we are doing 94%.